Welcome to Chat Florida TV. My name is Claribel Levin, so I'm your host. Here we are with Dr. Roberto Nicodemo. Hi, how are you
It's
today?
my pleasure.
Okay, tell me something about yourself. How long do you have been doing the medicine, and what is your primary?
Well, it's been quite a few years now. It's 35 years at least. Um, I originally studied medicine in Spain, but then the last year I have to move to Santo Domingo for 1,000 reasons. But then ended up there, and after like 6 years graduated, I moved to New York, and in New York Medical College, I completed a clinical preventive medicine specialty. Then I stayed on St. Clair Hospital, Midtown Manhattan, New York. Stayed there for that time. I get really attached to these people because it was a great experience. Anyhow, but then from there I moved to Georgia, which was a big change. You know, Georgia in a sleepy town, but I enjoyed tremendously also. Why? Because people understood that you were trying to really to help them out. So Georgia was a great experience. In Georgia, I added another experience, which is working with people with pain, but that depend on drugs. Because in the course of taking the medication for pain, they end up being drug addicts, basically, which is terrible, you see? So we had to deal with all that together. Great experience too, but there were many patients, you know, at least 60 every day. Yeah.
Okay. What the clients or your patient expect when they come here the first visit? What do they expect from you?
Well, you know, basically, and I think any doctor have to understand this. When a patient comes, they don't want much theory. They don't want much explanation. They need the problem solve.
Yes.
Period. Solve. If you cannot solve it in one shot, you tell them, listen, we're going to do this, this, and this. So you set up the plan for them and explain it. That's going to be the plan. So you can expect that in a reasonable time, 2 weeks, 3 weeks, whatever, that will be accomplished. So goals, yes, good point. It's very important, yeah, for the patient. And we must emphasize that's for sure.
Explain to me a little bit, what do you provide to the patients over here?
Well, being a community of people, most of them of Hispanic origin,
Yes.
you could expect, you know, quite a few problems. The first one is no insurance. They have no insurance, many of them. So we have to deal with that. And whatever little we have with the patient, with that we have to work. You see? Because you cannot tell a patient that comes here with a terrible condition, oh, well, you know, we cannot take care of you. The government can do that and put you a fine on top of that, but we cannot do that. So yeah, basically, you know, that's basically what is called primary care, and we do that, and we integrate the preventive aspect of medicine into primary care, because you want the patient not to fall in the same condition over and over and over. So you have to study what's going on with this patient that always, you know, falls on the same foot, on the same place. There, preventive medicine. You have to discover what it is. You have to set up a plan, a preventive plan, a clinical plan.
Yes.
So they both integrate, you know, very nicely. Yes.
Okay. Southwest Florida Regional Medical Center, they are part of the community.
Yes, they are.
Okay. Explain to me a little bit about that too.
Well, yeah, our CEOs and the top people, they always try to have a clinic that will really serve the needs of the Hispanic population. I just remember one patient the other day that told me, listen, I live in a community where more than 1,000 patients have no insurance at all.
Yes.
So you see, so there is plenty of room at least in Naples, to really do the kind of job that we do. We try to reach the community. We try to set very affordable plans for them if they don't have insurance, which many don't. So basically, I would say that that'll be our purpose to serve that community. Of course, that doesn't mean that any other person won't be, taken care of. Everybody, and I feel very comfortable with, working with different populations. You see, it's amazing how much you actually learn from that. And I believe a doctor has to learn something every day, not necessarily from the books, but from real life. Yes.
Well, thank you, Dr.
It's my pleasure.
Nicodemo.
Okay.
My pleasure. And listen, continue doing what are you doing.
Oh, we will.
Continue helping that community. They really need you.
Okay. Thank you so much.